Okay, so Ivor, go ahead and tell us about yourself.
About myself or about
yeah.
the thing?
Yeah, tell us about yourself first.
I don't know if I can tell anything about myself. I'm just an old man that'll soon be 89. And I hope that they didn't waste all that money on me down there.
So we want you to put it on this way. So with the back open, okay?
Right.
All right.
Tell me your name and your date of birth.
Joseph Ivor Riggs, January the 6th, 1930.
Perfect.
He had just returned home from serving in Korea when I met Ivor. We had been married about maybe a year or two when he went to work for the boatmobile.
They just started it up in 1959. I was the first bookmobile driver in the state.
It was quite a nice service for those small towns.
And I drove it all over 6 counties down here in southern Utah.
Nobody had phones or Google or any of that, so.
What I'd do is drive into these small towns and honk. After everybody'd left, I'd look back in the back of the bookmobile and there was a newborn baby in a little basket. When the lady remembered and come back, she said, "If you tell that story, I'll deny it."
Over the past 2 weeks, how much has your heart failure limited your enjoyment of life?
This summer I had an early spring and summer I was having a lot of problems, a lot of dizziness and a lot of headaches.
Hi. How are you doing today? So Mr. Riggs came to us and he was struggling with something that we see quite often in people, usually a lot of fatigue, shortness of breath, and even occasional lightheadedness.
He couldn't work, he couldn't do a lot of things, and if he did try to, it was very debilitating for him. He got very tired and couldn't rest from it.
A lot of people blame that on getting old, aging. And there's a lot of things that can cause those symptoms, and his situation was because his aortic valve was getting too tight.
A lot of people can say, okay, I won't try to do anything, I'll sit and read a book, but he's, like you say, he's always been very active, so it was difficult for him.
And most patients are not alive by about 3 years once that valve hits the severe mark, which has had. And typically what happens is the quality of life goes drastically down.
I think that he had pretty much come to terms with that was how his life was going to be, and so of course, so did I.
It's a mechanical problem, and so traditionally the only thing that you could do is replace it.
And I decided I'd see if they could do something to make me feel good with the short time I had left here on Earth.
The past 20, 30 years, the only way to do that is to open up somebody's chest.
And then he said they had a new procedure where they could put a valve up through the groin and put in there.
So in 2012, the FDA approved a new procedure called transcatheter aortic valve replacement.
In order to be a candidate for TAVR, you have to be deemed to have sufficient risk with an open operation, but he's older, and with his comorbidities, TAVR was a very, very good option for him.
The nice thing about these TAVRs is instead of having your zipper incision that goes, all the way down here and opening you up, you just have an incision in your right groin and in your left groin. They're a little bit bigger, but they heal beautifully, and sometimes they're bruised for about a week, maybe 2, but generally recovery is really quick because of it, so it's pretty awesome.
They wouldn't have to crack his chest, and so that part sounded good.
All right, take care.
Yeah.
Good luck. You'll do great. You have a great team.
It's kind of chilly in here. We got some more blankets for you, though. You like warm blankets? Good. I'm glad you like them because we got stacks of them.
With the expansion at the River Road campus, we now have a hybrid angiography suite that allows us to perform open surgery and do imaging procedures in the same location.
Traditional open heart procedure, you have to open up the patient to visualize what you're doing to make sure you're accurate and precise in what you're doing. The fluoroscopy machine allows us to see what's going on without opening the patient and allows for this type of procedure to be possible, as well as many other procedures for that matter.
With a hybrid operating suite, it allows us to perform surgery, but at the same time, we can use imaging, or in this case, x-rays, to see through the body and see what we're working on inside the body indirectly.
That allows us to be able to maximize the interventional cardiologist techniques and skills, as well as the cardiothoracic surgeon's technique and skills, in a way that puts the patient once again front and center.
We can use x-rays to see through the body. We can watch the device advance through the patient's bloodstream.
That allows us to see in real time what's going on inside the patient.
And we can position it accurately in the patient's aortic root. And when necessary, we can deploy it and watch the valve expand in front of our eyes.
I think we go up right there. Going up. 1, 2, 3. And pacer off.
It was probably 6 hours after the procedure that they let me get up to the bathroom, and that's when I could tell there's a big difference.
We did the valve. It worked out fantastic for him. He was able to go along his hospital care as good as it could possibly go.
It's just amazing
Oh, good.
how good I feel after that. It's so
Yeah.
quick.
We get out of the hospital in a reasonable time, and he's noticed a significant improvement now in his quality of life.
Well, obviously, it's improved it a lot. Don't have that grouchy old man in the house.
And on top of that, not have to feel like he got beat up in the process.
In the future, very likely we'll be doing heart valves in all 4 positions this way. Very likely combined procedures as well. We're going to need increased staffing to be able to do these procedures. We need more cardiologists in town to allow people to get seen in a timely manner to come in and have things done.
I'm just appreciative of the fact that there are such miracles in our world today.